Hi, everyone. Happy Thursday. Thank you all for joining us. Just waiting for Dr. Amalfi to hop on and we'll add her in. But today we are going to be talking about fillers. Last week we were hoping to talk about both Botox, neurotoxins, and fillers, but there was just so much to talk about neurotoxins, so we just focused on that. So if you guys have any questions about fillers, just throw them in the comment box and we will be sure to answer them. So I see Ashley on right now, and I'm sorry about the time change. We've kind of switched it up on you guys a few times, but we're here now. Hi.
Hi, how are you?
I'm good. How are you?
Good. We got a
Beautiful as
timer ready.
always. We are ready. I'm going to turn the timer on. So you guys, 15 minutes. It's going to be rapid fire. Everything you ever wanted to know about fillers. So,
It's like a monsoon outside here. So if
oh,
I
is it?
lose, it is crazy storm. So if I lose internet connection or jump out, I'll just request to come back in.
Okay,
But
sounds good. Thanks for the heads up.
it's crazy.
Um,
You're gonna hear it in the background.
oh goodness. Okay, let's get the timer started.
Go
Can you do
girl.
it? All right, we're ready to go. All right, so we're going to talk about fillers today, and we've had a bunch of questions come up already. I think from people throughout the course of the week.
I mean, I
So
think the important thing is to like talk about what they are because I think people worry like what is this stuff that we're putting in our face. And
right.
you're super good at explaining all of these types of things, but hyaluronic acid is the most common filler that we use, and we naturally have that in our skin. So it is just a synthetic form of that protein that we are adding to the skin to add volume.
Right.
How do you explain that to patients?
I tell them the same thing. Hyaluronic acid, our cells use it to moisturize and to plump themselves up. And so this is just a man-made version. So it's very safe if it's injected by the right person who's well trained in them. But it's harmless. You don't need a skin test. It's very natural, no allergies, like none of that stuff to worry about. And it just looks like a clear gel.
Yeah. I tell people it's kind of like a clear toothpaste, and so when I'm explaining what we do with it, we inject it into an area to just sort of plump it up. So unlike neurotoxins, which we talked about last week, which stop movement to prevent the creation of lines, filler is all about volume. So anywhere that there's a crevice or a loss of volume and we want to add volume, that's we plump it up with filler essentially.
Right. Exactly. We plump up the lines, and then as we age, we lose fat in very discrete areas in our face. And so this is a great option to just replace the fat that we've lost for a more youthful appearance. So I actually have a syringe of volume.
Yeah.
You guys, like it's just this clear gel. This is like so old. So, um, but it just I don't know if you can see. It's just a gel. It's pretty smooth. That's it. And
Pretty
this is
cool.
one syringe. So this is, it's not that much volume. But injected in the right places, it does wonders.
And so, what kind of trends are you seeing with filler after COVID?
Oh gosh. Everybody wants their lower lids done.
Yeah,
Yeah.
yeah.
Of course, like lips are always popular no matter when, I think. But lower lids, all people are seeing is this, right? So
100%. It is
all
exactly literally every day, all day, everybody wants their tear troughs. And it's because they're sitting here like us, they're looking at themselves in a screen, or they have a mask on, and the only thing you see is under your eyes. And
right.
so let's talk about that a little bit. You and I have talked about the different types of product we like to use in that area. And I think this kind of highlights the importance of really seeing someone who knows the anatomy when we're doing something like this, because the anatomy there is so critical. And if you get a post-septal injection, it can cause a lot of swelling of the eye. So you'll hear people who got their eyes injected and then they get like these swollen bags under their eyes. And that's because it was inappropriately placed, or that they chose the wrong filler. And so there's very specific fillers that are not hydrophilic, meaning they don't draw a lot of water and moisture into them, and they create a nice smooth appearance instead of that big bogginess under the eye. So you and I have talked about we like Restylane under the eyes
Restylane
and
is great.
Volbella.
Yes, and Volbella doesn't attract as much water as well.
Exactly.
So,
So
and they're
they're
all
smooth.
hyaluronic. They're just really smooth and really thin, so it just kind of blends in and almost like melts away under your eyelids. So they're
A
great.
good question is about cannulas versus using the needle. Do you have a preference?
I honestly typically still use needles.
Yeah.
Unless it's someone that I know is going to bruise really easily, and I can tell just by looking at their skin. You can almost see the vessels underneath. They have this green or blue tinge,
Yeah.
and those I would,
Yeah.
I'll do cannulas, but I inject so deep anyway that like it doesn't tend to be a problem. I pretty much, and you do the same thing, right? Just
Right
on
on bone. Yeah.
pump everything up.
Yep.
So it depends, but I always at some point switch over to a needle because I like to get that little area right there, and you just have to put a little dollop superficially in there. So
Yeah. I'm just the same. I mostly use a needle too. I don't think it makes a big difference with compared to the cannula. I do sometimes use a cannula, especially if people have a lot of superficial volume loss. I feel comfortable getting very medial with that cannula. Um, I've had both done. I've had it done with a needle and a cannula, and I thought I was going to love the cannula, and I really didn't. I like the needle so much better. The cannula is just like a little bit more blunt, and you can feel it moving around in there. The needle it goes straight down to the bone. You don't feel it. You feel like the tiniest prick. And then I also always tell patients that when you inject the tear troughs, the lower lids, you can almost hear the gel coming out. And I tell them it sounds like toothpaste kind of squeezing out. And then they're always like, oh my gosh, I'm so glad you told me that because it sounds so weird,
right,
but totally normal and
normal.
so painless in that area. I think everyone's always so surprised with how painless it is to have an injection in that area.
Right. Well, and that's the thing. It's by your eyes, so people are nervous about it just by default. But the needles are tiny, and I do always put a little numbing cream under that. I think it helps with that initial needle.
Yeah, I do
Um,
sometimes as well. Not
yeah,
always, but
not always. It really
yeah.
depends on the patient and how nervous they are and crazy they are.
Mm-hmm.
But yeah, I mean, both look. The nice thing that I like about needles is that you can be very targeted. Usually with the cannula, you have
Yes.
here and you're trying to get things
You're
up there.
coming at it from afar. I totally agree.
And I just like going straight down a little bit on the bone, and that's kind of it. And most people don't bruise that much unless they do have that really thin, fair skin. But they're going to bruise no matter what. I think the key is really having someone who's knows the anatomy.
Someone just asked, can you close your eyes when getting injections in the area? Yes, most
You
people
can.
do. Most people do. Sometimes people will say, I really want to keep my eyes open and kind of watch what you're doing. I don't think it mattered
Right.
at all. I think you can try, you can do whatever, both, whatever makes you comfortable.
Whatever makes you. I do though sometimes have people sit up, so I'll lay down like the first layer, and then I'll have them sit up.
I like it too.
It makes a huge difference.
I totally
And
do.
then I'll also have them look up because you can see the septum. You can see the tear trough a little bit better when they look up, so I can like really get in all the
See
fine
it
lines.
pull and tether. Yeah, I totally agree with that.
And
I've
false
noticed,
lashes.
yeah.
People who have false lashes, sometimes it covers the area that we need to inject. So I do make them keep their
Open their
eyes
eyes.
open.
Yes.
Otherwise, I can't see anything.
Or take them off. Yeah, totally. I mean, and you and I have a very similar technique for a lot of our fillers. I love putting filler really deep and on the bone because we're adding volume. We're really not like addressing the skin as much as we're addressing the volume of the face. And I think when you go down on the bone, you are not it's not painful, even though it sounds like it might be painful.
Right.
It is actually less painful, less bruising, less injury to the skin, and it lasts longer because your muscles aren't moving it around and it's not metabolizing as quickly. And so you're going to get longer lasting results with these sorts of fillers.
Right, exactly. And someone had said that they had fair skin, and I think the same thing, right? Fair skin patients tend to bruise a little bit more, but if you're deep, and you really avoid those tiny little vessels that are right underneath the skin, people tend to do really well.
Do you, Smita, do you believe in Arnica?
No. I mean, it's a placebo. I put it on everybody. I think placebo, maybe it has some sort of effect, but I don't really see a difference. I don't think it speeds it up at all.
Yeah, I
You
mean,
bruise for a few days, it
yeah.
gets better. I don't think it's, you know.
We give it, we have it. If I give myself a bruise, I always take it and use it. And the bruises like don't even bother me. Like I literally had like a black eye from my crow's feet Botox and whatever. I mean, I just put makeup on it. Who really cares? I don't care.
They don't
Yeah.
last
And
that
then it
long.
goes away after a couple of days and it's like
Exactly.
not one person noticed.
Exactly.
Yeah.
Somebody asked about Versa. Have you tried Versa?
I haven't tried it yet. Have you?
I have. So I would not use it in the tear troughs. It is a pretty stiff filler. I think there is a place for it maybe in the nasolabial folds, or if you dilute it a little bit and just kind of thin it out. I mean, I injected it into my lips and I did not like
Really?
it. It's just too stiff. I
Yeah.
like, I like Restylane or even Juvederm Ultra. I just like the softer fillers.
Yes.
So
Yes.
that was just a little too stiff for me. But I mean, I know so many people that love Versa.
Someone just asked what's arnica. It's just a supplement, like sort of like an herbal remedy for bruising. It's for bruising, pain, swelling, inflammation. It's just an anti-inflammatory that you can use like as a gel or a cream, or like a sublingual tab. So people use both.
Right, right.
Um, have you tried Restylane Kiss for lips?
I haven't. Have you?
I like
I
it a
mean, I ordered a
lot.
bunch. I'm waiting for it to come in, but I've heard amazing things about it.
Yes. I mean, I like the Restylane products. I think they're really soft. I also think that they don't get puffy. And some fillers, I find they get like a very puffy, obvious look. And I find that the Restylane, it stays where you put it, and
Yeah.
it just looks very clean. And I found Kiss to be, the same. You can go much closer to the skin with it, and when you do that, you can get a more dramatic result. Or if someone wants a more subtle result, you just put it a little bit deeper. But it has that versatility, which I think is cool.
Nice.
I've also liked it in some women who already had lip filler and wanted to add more, and because I could put it so close to the skin, I could kind of build on that. I liked it a lot. So it's a new product that's designed just for the lips. So it's super soft and malleable, and people are.
That natural.
It really is a
feel.
natural, pretty, soft look instead of like a very stiff, like we were talking about, like overdone look. It looks really natural and pretty. And as an injector, it's so smooth. You like actually notice the difference. It's like a pleasure to inject it. It's just like such a pretty consistency. It's been cool.
Right. I love that. Well, I meant to say about the lower, I'm going back to the lower lips for a second.
Okay.
So the other thing about the deep injections, which is nice, is you don't get as much swelling or bruising. So the
Yes.
swelling sometimes, so when I first started, I used to do a lot of subcutaneous, just like right underneath the skin.
I think that's how we used to do injections in
was
general.
taught.
Me too.
Right.
And
I
it's
was
really
taught to do
changed.
that. But I mean, patients would get so swollen that like it distorts what you're doing because you don't know how much is filler and how much is swelling. You almost
Yes.
have to like stop, have them follow back up again, and then redo it when the swelling is gone. And,
Yeah.
it's just too irritating.
I feel like when we do these creases here, which are called the nasolabial folds, I feel like we used to do the same thing. Like when I started learning about filler in my training, we were doing it very close to the skin, filling in very fine lines. We can still do that, but I feel like we've gained so much more knowledge that by using actually thicker and bulkier products deep on the bone, you actually replace the volume that's lost instead of just chasing a small crease in the skin. And I think it's just really addressing the problem, and it's making people look more youthful in their face as opposed to like puffy and kind of strange.
Right, exactly. Well, and that's the thing. I feel like people, I don't know. I mean, you can spot the filler look from miles away.
Yes. I don't want that. Yes.
Your face moves like as one. It's not supposed to do that. Your cheeks are like up in your eyes. You get the chipmunk cheeks.
Yes.
And it's just, it's overly done. First of all, they just put too much filler, and it's not in the right places, right?
Yes.
So that's why, anatomy is key. And so that's why, I think we're able to put filler in deeper because we know it's safe. We know there aren't any big nerves or vessels in certain areas, and it's safe to put a needle in there.
Mm-hmm.
And fill it up. And we know where the fat pads are in our face. There's very discrete fat compartments, and we can just fill those up, and it just gives you that youthful.
I think that's the difference between a natural look and an overdone look, is that in a natural look, you're really restoring the volume in the areas that it's been naturally lost. And I think in that overdone look, I think they're just adding too much, and sometimes even to the wrong areas. Someone asked about jaw contouring, and I think that's a cool one that we can talk about. That is totally an awesome way to do it. I mean, you can even give someone a chin with filler. You can completely augment the jaw. You can create like a very nice angle to the jaw. Mm-hmm.
Yeah.
And
it's for men too, because
it's
the
awesome for guys.
Jaw is really angular, and it just really adds a good amount right on the bone. Just gives you that nice fullness there.
Yeah, again, that's a safe one. It doesn't bruise a lot. It is not very painful at all, and tiny little needle, and you can really just build it up and create structure where there is no structure. So yeah, I agree. That's totally a great one for guys.
And women who like
yeah.
a fine jaw.
And it lasts a long time.
It lasts a really long time. But the chin, someone got chin filler. Chin filler is awesome because it really just improves your profile.
Oh my gosh, we plow through 15 minutes. Okay, awesome.
Awesome. Well, that was so much fun.
I know, that was
so much we could talk about.
Well,
we didn't even talk about the non-hyaluronic acid fillers.
We'll do like another more atypical filler day. I mean, there's so much we can talk about on here. Yeah. I think, keep giving us ideas, whatever seems like it's interesting to you guys and you're learning. We're happy to give more.
Yep, absolutely. Well, thank you so much.
This was fun.
And Ash, I love it. Oh, threads next time. We got to talk about threads.
Okay. We're on it. We're adding it to the list.
We are going to add it. We'll talk about that for sure. Well, thanks everyone for joining. Enjoy your night.
Bye. Have a good night. Bye, Smita.
Bye. Love you.
Love you.